sun shines bright in the old Kentucky home. To summer the darkies are gay, the corn tops ripe and the meadows in the bloom, while the birds make music all the day.
One of the traditional methods of imposing statism or socialism on a people has been by way of medicine. It's very easy to disguise a medical program as a humanitarian project. Most people are a little reluctant to oppose anything that suggests medical care for people who possibly can't afford it.
The young folks roll on the little cabin floor, all merry.
Thank you, Mr. Speaker.
The gentleman is recognized for 5 minutes.
Mr. Speaker, our government has been mismanaging medical care for more than 45 years. For every problem it has created, it has responded by exponentially expanding the role of government. Here are some points I'd like to have my colleagues consider. Number one, no one has a right to medical care. If one assumes such a right, it endorses the notion that some individuals have a right to someone else's life and property. This totally contradicts the principles of liberty. Number two, if medical care is provided by government, this can only be achieved by an authoritarian government unconcerned about the rights of the individual. Number three, economic fallacies accepted for more than 100 years in the United States has deceived policymakers into believing that quality care can come only by only can be achieved by government force, taxation, regulations, and bowing to a system of special interests that creates a system of corporatism. Number four, more dollars into any monopoly run by government never increases quality, but it always results in higher costs and prices. Number five, government does have an important role to play in facilitating the delivery of all goods and services in an ethical and efficient manner. Number six, first, government should do no harm.
Have a right to a health care, you have to realize what that implies. It's not an abstraction. I'm a physician. That means you have a right to come to my house and conscript me. It means you believe in slavery. It means that you're going to enslave not only me, but the janitor at my hospital, the person who cleans my office, the assistants who work in my office, the nurses. If you have a right to their services, basically, once you imply a belief in a right to someone's services, do you have a right to plumbing? Do you have a right to water? Do you have a right to food? You're basically saying that you believe in slavery.
Happy and bright, by and by hard times comes a knocking out the door. Then my old Kentucky home, good night. Weep no more, my lady. Oh, weep no more today. We will sing one song for the old Kentucky home, for the old Kentucky home far away. They hunt no more for the possum and the coon on meadow, the hill and the shore. They sing no more by the glimmer of the moon on the bench by the old cabin door. The day goes by like a shadow o'er the heart, with sorrow where all was delight. The time has come when the darkies have to part. Then my old Kentucky home, good night. Weep no more, my lady. Oh, weep no more today. We will sing one song for the old Kentucky home, for the old Kentucky home far away. the head must bow, and the back will have to bend wherever the darky may go. A few more days, and the trouble all will end in the field where the sugar canes grow.